For someone to contract monkeypox, it usually takes 1 or 2 people to transmit the infection to a new person. But during the days of COVID, a single person could infect more than 10 or even 15 people, so its rate of spread isn't very high. Monkeypox has received a lot of media coverage recently because of the increase in cases over the past period and the increase in the number of deaths resulting from it. Let's talk in this video about everything related to monkeypox. What is this virus and where is it found? How is it transmitted? What are its symptoms like? Is there a treatment for it or not? Can we prevent it from infecting us in the first place or not? If we do get it, what should we do? What should we do with our patients who don't show its symptoms? Should we isolate them or not? So stay with us until the end of the video so we can cover every point. Let's start first with the virus. Monkeypox virus has strains found in Central Africa and West Africa. The strain found in Central Africa is probably more dangerous and has a higher mortality rate, and the severity of the cases it causes is greater, but the virus found in West Africa usually has milder symptoms most of the time, and its mortality rate is lower. But let's agree that both have a low rate of transmission, so we can't treat it the same way we did during the COVID days. Alright, that's the name of the virus and the regions where it's found. This disease spreads to other places. Cases have started to be recorded in the Arab world, in Europe, and in other places as well. This is due to people traveling from those regions to other places, or because animals have traveled from those areas to other locations. How does the infection spread? Infection can occur either directly or indirectly. Directly, this happens when a person who does not have the disease comes into contact with someone who does. Direct skin-to-skin contact, whether it's without sexual contact or during sexual intercourse. The skin that has the rash or lesions caused by monkeypox, direct contact with another person. There is also an indirect way where transmission can occur through droplets from the mouth. Another way is through contact with fluids or objects that have been used on the skin of the infected person. There are fluids that come out from the rash present on the infected person. These fluids could get on a towel or a bed sheet, and then someone else might use them. Someone might sleep on the same bed with the sheet that has fluids from the rash on it. So how is mouth droplet transmission possible? When we're sitting together in a closed space, like a closed room, and talking to each other, droplets come out of our mouths as we speak. Of course, the amount isn't much, but if there's coughing or sneezing, the amount becomes larger. But it requires being in a small, closed space and staying there for about 3 hours or more for there to be a chance of infection spreading. So these are the ways the infection spreads. Now let's talk about animals. There are also animals that can carry this virus, whether they're monkeys, rats, or other animals that have caught the infection from them as well. When there is contact with them, the same transmission of infection can occur and symptoms may start to appear. The incubation period for this virus that's currently recorded is different from what was previously recorded in 2022. Currently, the period ranges between 3 and 13 days. So what does that mean? It means that for symptoms to appear after I've caught the infection from another infected person or animal, symptoms might appear in me after 3 to 13 days have passed, and in some cases, they've been recorded at 21 days or even a bit longer. So symptoms don't always show up the very next day after interacting with an infected person, because a lot of people who start showing symptoms begin to wonder, who did I interact with yesterday or the day before? Even though it's possible that I interacted with someone 21 days ago, and that's who caused the infection to be transmitted to me. So, doctor, what are the symptoms that result from the infection? With the monkeypox virus, symptoms similar to the common cold. There might be fever, headache, body aches. There could be a runny nose, nasal congestion, or cough. There might be symptoms of eye inflammation. Some people have had inflammations in the genital area or in the mouth. In some cases, there is swelling and inflammation of the lymph nodes in the body. And the skin rash, this is probably the most distinctive sign of monkeypox. You'll see its appearance on the screen. It's very distinctive. But let's agree that there's also something similar to it, which is called chickenpox. We used to call it that because it looks a bit similar, which can confuse people at the time. Is this chickenpox or is it monkeypox? Leave that decision to the doctor. They're the one who will determine it. So that's it regarding the symptoms. So how do we diagnose it? A suspected case, what does a suspected case mean? It means someone coming from West Africa or Central Africa, or someone who developed symptoms after being with someone from those areas. The symptoms we just mentioned, if we suspect a case, there are tests, like one that detects antibodies, and there's also a test that looks for the virus's DNA itself, which is the PCR test. These tests are available in government hospitals or in central or public hospitals across the Arab world. So, now, if we've confirmed the diagnosis, what do we do? First, the person must be isolated, meaning there should be no contact between them and other people. If their symptoms are mild, the treatment is just for the symptoms, things to relieve the symptoms. So if there's a fever, we give fever reducers, something to ease the physical pain and make sure they stay hydrated so the immune system stays strong, along with healthy, balanced food. But if the symptoms are very severe and the patient's overall condition is bad, they are admitted to the hospital and antiviral medications are given in specific doses inside the hospital. In addition to the treatment for the symptoms, so when do we consider the person to be non-infectious and start interacting with them again? There isn't a specific time frame up to now, but what is recorded in reliable scientific sources like UpToDate, for example, is that after all the skin rashes have turned into scabs, and all the scabs have fallen off, and new, normal skin starts to appear. That's when we start interacting with them normally. And by the way, that's what we do as well with infected individuals. If we have a patient who develops symptoms, they start symptom treatment in the same way and for the same duration. If they're at home and not in the hospital, it's usually about 2 to 4 weeks, sometimes a bit more than 4 weeks. That can happen. But most of the time, it doesn't go beyond 4 weeks. Okay, so what about the contact who doesn't have any symptoms? Do we isolate them? Now, let's say I have someone who has symptoms and was with other people today, yesterday, or within the past 21 days. Should I isolate those other people or not? We only isolate those who develop symptoms. If someone doesn't show symptoms, they don't need to be isolated at all, and we don't give them any medication or anything else. However, in some countries they give them the specific vaccine for it, and that brings us to how we can prevent it from happening or reduce its symptoms in order to stop it from occurring. The best thing is to avoid traveling to those areas in the near future. And secondly, if we have someone who is infected, everyone who has been in contact with them should follow up with their doctor and start paying attention to their skin and watching out for symptoms. If symptoms appear, we consult the doctor. If no symptoms appear, then we're safe. So, we should avoid exposure to and contact with an infected person as much as possible. And if we have to interact with them because we live in the same house or are preparing food or providing medical care for them, it's best if we wear protective gear so we don't catch the symptoms. So what does the vaccine do? We either get the vaccine when we're healthy, haven't been exposed to anything, and don't have any symptoms. And by the way, this doesn't prevent infection, but it greatly reduces the severity of the symptoms. Or, in some countries, people who have been in contact with an infected person but don't have symptoms can be given the vaccine. Let's always make sure not to panic because of monkeypox, because, as we said at the beginning of the video, its rate of spread isn't high. And as a result, the number of recorded cases is very low. The mortality rate of the strain found in Central Africa is about 10%, and thankfully that's the least widespread strain in the world. The recorded mortality rate of the strain found in West Africa is about 1% or less, so there's no need for panic. Let us know your thoughts about the video in the comments. If you have any questions or inquiries, record them for us or write them in the comments on the video. Don't forget to subscribe to our channel. If you find these videos helpful, share the video, especially if you know someone who would benefit from the information in it. And don't forget to like the video. See you soon.